Hello, everyone. Posting and taking care of dignity. So these skills, so resources, Noor. I want to tell you tell the secret to everyone how I develop the interpersonal skills and still how I develop interpersonal skills. I see the doctors who are good doctors already working in this culture. So the best way to find out that how this culture works, British culture. So I've been in medical school. I was watching A&E 24 hours present is on the Netflix as well. There's a free GP behind closed doors. So if you see their interpersonal skills and you can develop those interpersonal skills in while practicing your PLAB-2. So I can write it down. GP behind closed doors is on the YouTube as well, and A&E 24 hour. Just see how they approach the patient. If you have time, like 2-3 months, and in your free time, try to develop those interpersonal skills in your consultation. GP behind closed doors. Yes. Thank you, Noor. So
Yeah,
more
just a second. Doctors, we do read your questions and we will be coming back to your questions to answer them. So please don't worry if we are not right away answering your questions. We do see your questions and we will be coming back to your questions, okay?
Yes, yes. Thank you very much. So I'll quickly walk through this ebook, and after that, we'll come back and we'll start taking your questions. So if you see this ebook, I will be sharing this ebook in the news group and my UKPass Academy group as well. So it's quite interactive. You can see that active listening. I can see your feelings. So few of the things in the beginner level, you can see professional. I have developed a few of the structure of model from the GMC marking scheme. I put it those structure of that whenever you're starting doing 8-minute consultation. So start with a smile. So you can take a screenshot of that and you can start using that when you will be practicing. ID check, introduce yourself, name preferences, everything that would be a part of your consultation at different point. Just need to understand how it would go. Presenting complaint, appropriate history, acronyms you already used in the PLAB-1 as well. So all of the things are, you have the knowledge, and this is the time how you deliver it. If you are introvert, if you're shy, you have to speak a lot in front of mirrors, camera. I used to record my PLAB-2 videos when I was a beginner. Still I have those videos, and I used to record that, and now I can see that how you improve on with the time. So try to record yourself, try to listen your tone and everything, and I will be coming to idea, expectation, concern, but don't overwhelm. Just understand this is a structure. You will be very you will be pro in 1 to 2 weeks when you start practicing it. So smile. Few other things are here in this structure. These are the things you will do. There are different history taking techniques are here. You can use. It's just a beginner. It's a 15 pages book. So you can find that, and I'll be sending you in the UKPass Academy group as well. And if you don't know us, we are the group of doctors who are working in NHS, and that is in Oldham, Manchester, where your exam center would be. And we have lot of courses around here, or practical session and everything. So let's move back to the part where I would like to ask Noor a few questions. And Noor, yes. So guys, let's answer a few questions at the moment, then we'll come to the other part of our webinar, that is MLA content map, a few things and a few other questions. Noor, would you like to share anything? And after that, we just answer a few questions and then.
Yeah, I would like to address the language part that you just mentioned, and that was right. If we go to the GMC marking criteria, along with some different categories, we would see a category of language, and that language category, basically it means how you are using empathetic statements with the patient. Like, you're not being too straightforward, saying, if I say two statements, it will give you an idea about how the doctor is talking to the patient. For example, it's a patient with a terminal illness, and you are breaking the news, and you are going to say that, I'm really sorry to say, but I'm afraid he's going to die. This statement, and I'm really sorry to say, but I'm afraid his condition is terminal, and he might not make it for long. There is a difference in these two statements. Okay, so this is how you change your sentence, you modify your sentences, and show that you are not very straightforward with the patient. You are conveying what you have to say. At the same time, you are taking into consideration the attendant's feelings as well. Okay, so this is what Dr. Zeeshan meant by the language part, and you have to really be very considerate about what kind of statements you're using, because you have to paraphrase. There is always a paraphrasing available for different statements. So this is what we mean by language, and this is what GMC is basically looking into. I'm saying this because I have been taking a lot of mocks by different doctors, and that is when I realized that some people, when you're breaking the bad news, you are being very straightforward, and the only thing you mean by showing IPS is using the words or statements like "I'm sorry to say" or "I'm really afraid. I understand it must be very hard for you," and then you use a statement that is very harsh for us to hear. So it's not just that, you have to use considerate statements as well.
Yeah, I agree, Noor. I agree, 100% agree. The thing is that we should be active listener. We should
Yeah.
respond. We are human. So I want to highlight another point is the robotic thing and stock phrases. You just highlighted that. So the only problem when I see doctors who are not able to pass their PLAB-2 exam in first attempt, that they learn stock phrases and they do not know where to use them. So that's the one of the thing is the robotic doesn't mean that you are scripted, you learn anything. So scripted basically mean that you don't have any emotions. For example, if somebody is going to tell you that they have a marriage next week and you don't care about that, or you don't congratulate them if they said that their mom got the cancer, and you don't go out of the box and you don't appreciate them, and you don't make it natural, that means that you're robotic. Your tone is just like a tone that causing us. So whenever somebody is going to enter into the cubicle, they must go with energy, happy, contagious smile. When you look at the examiner, very polite, I'm Dr. Ghaffar, and tell that good morning. And after that, the smile should be in the air, the examiner breathing same air, the simulator breathing the same air. So you will work on that, everybody. So just keep in mind for the PLAB-2, you have 3 buckets at the moment. You need to fill all those buckets slowly. First, history taking skills. The second bucket is your IPS interpersonal skills, then management. So in management, so that would require a bit of knowledge and approaches as well. So we will talk about that. So Noor, before I move further about those buckets, about how to improve those buckets as a beginner level, I would like to ask a few questions from MLA content map. I'm going to share my screen of my that blackboard, and then we're going to talk about that. Okay. So that MLA content map, everybody can download that content map, and they must download and have a read. So what basically that content map is showing us, and I'm going to break it down for your understanding, all of you, so that you understand what MLA content map is about.